So the clinical psychology PhD program is a 5 to 6 year program. 4 to 5 of those years are classwork, followed by a professional internship year.
Our program is designed as a scientist practitioner model. In other words, we do research and we see clients. So our research skills are needed basically to help us write our thesis and our dissertation. So the thesis is the requirement for a master's degree, and then the dissertation is a requirement for a doctoral degree.
In our 3rd and 4th grade, many of us begin teaching Psych 101 to undergraduates, and later we have the opportunities to teach more advanced classes.
We also have the opportunity to mentor undergraduate students who are interested in going to graduate school.
So after we complete our PhD program, we're still not licensed, so we have to do 1 to 2 years of postdoctoral training and take our state and national licensing exams.
So I work at The Practice, which is an on-campus clinic at UNLV. I do primarily work with adults doing therapy and assessment services. We also have a group program and telemental health services for children and adults.
We both work at the Center for Applied Neuroscience. We administer like 6 to 8 hour neuropsychological assessment batteries that look at domains such as attention, processing speed, memory, and so forth. And then we take those results, write them up in a report that also includes diagnosis and treatment recommendations.
And we work with patients who are adults, adolescents, children with a wide range of neuropsychological issues. So spanning from, for example, ADHD and learning disorders to dementias and traumatic brain injuries.
I work at the Children's Heart Center, and I work with patient families who are dealing with a chronic heart condition. And in therapy, we address emotional trauma and distress in order to improve psychological well-being.
I do my clinical work at the School Refusal Clinic, so I work with kids that don't go to school or have severe anxiety disorders. So I work at Desert Rural Treatment Center, and I work with children and adolescents who've been hospitalized in an inpatient psychiatric setting.
So I work at a private practice, and I provide group psychotherapy for a really wide variety of patients and presenting concerns.
I work at the Center for Emotional Health, and we work with individuals who have eating disorders and related concerns.
I work at the VA, so I work as a therapist with veterans who have mostly anxiety, depression, and PTSD.
So we're from the Dime Lab, and we study irritability, mood, and sleep disorders. The populations that we work with are children, adolescents, and young adults.
I work at the Stream Lab, which researches risk for eating pathology, and we collect saliva and DNA samples from participants looking at testosterone and androgen receptor genes, things like that.
Well, we're from the Neuropsychology Research Program. We do our research under the supervision of Dr. Dan Allen, our research advisor.
We work with various clinical populations, including people with schizophrenia, people with bipolar disorder, individuals with traumatic brain injury, kids with ADHD, among others.
For example, we investigate social cognition in people with schizophrenia and bipolar disorder.
We also look at the psychometric properties of a baseline assessment for cognitive abilities following sport concussion.
And we also do cross-cultural research to examine performance differences of English and Spanish speakers on neuropsychological measures.
So I work with Dr. Chris Carney, and we study anxiety and stress disorders in children and adolescents.
I work in the Psychophysiology of Emotion and Personality Lab, and we collect EEG data to look at the psychophysiological correlates of psychopathic traits.
We work at Family Research and Services, and we just finished a $2 million National Institutes of Health funded randomized controlled trial assessing athlete mental health and sport performance.
So I chose clinical psychology because people are fascinating, and in all honesty, I really think that it's important to understand the brain and really get at how that's affecting human behavior.
I chose clinical psychology to understand and unravel the complexity of human emotion, behavior, thoughts, and psychophysiology.
I love teaching, and I love helping people, and this gives me an opportunity to teach people skills that make their life better, and I can't think of a better job than that.
Psychologists do so many different things.
We're not just therapists. We are scientists.
That physical and mental health are interrelated.
We are in the business of helping people.